You're about to do something most people think is simple. Check your blood sugar, a tiny finger prick, a number on a screen, and you move on with your day. But here's the twist. Blood sugar testing isn't just a measurement, it's a message. And if you don't know how to read that message, or you accidentally distort it, you can end up making decisions based on a lie. Today I'm going to walk you through the most common mistakes people make when testing blood glucose, 13 of them, and how to avoid every single one. Along the way, I'll give you a clear mental model of what blood sugar actually is, why high isn't the only problem, why normal is often misunderstood, and how people with type 2 diabetes can often improve dramatically, sometimes even reach remission, by changing the inputs that keep the whole system stuck. Quick note before we begin, this video is education, not personal medical advice. If you're on insulin or medications that can cause low blood sugar, don't change your diet or fasting routine without your clinician's help, because the better your habits get, the more your medication may need adjusting. Now let's reset your brain with the visual. Imagine your entire bloodstream as a big jug. In that whole jug, at a typical fasting glucose level, you're dealing with only about a teaspoon of glucose floating around at any one time. A teaspoon, that's it, tiny. And your body guards that amount like a bank vault because too much sugar in the blood is corrosive, sticky, reactive, damaging over time. The line between normal, pre-diabetes, and diabetes isn't an ocean of sugar. It's a small shift in that small amount, and that's why your control systems matter more than most people realize. Here's what catches people off guard. If you haven't eaten sugar in hours, you can still have normal blood sugar. That's not a glitch, that's survival. Your body needs a baseline level of glucose, and your liver can make it from other raw materials. You don't need to eat sugar to have blood sugar. What you do need to understand is why people can eat a massive amount of sugar and starch and not immediately turn into syrup. The reason is the invisible cleanup crew working behind the scenes, insulin. Insulin is like a fleet of vacuum trucks. Every time you eat, especially carbs and sugar, insulin rises and pulls glucose out of your bloodstream, pushing it into storage, into muscles as glycogen, into the liver as glycogen, and if those storage tanks are already full, into fat cells. That's why someone can have not terrible blood sugar for years while the deeper problem is quietly growing. Blood sugar is the headline. Insulin is the hidden paragraph that explains what the headline really means. When the system has to push out more and more insulin to keep blood sugar from rising, your tissues gradually stop responding normally. That's insulin resistance. And once insulin resistance takes hold, your body struggles to move glucose into cells efficiently. Your pancreas works harder, and your liver starts doing something that confuses people. It keeps releasing glucose even when you don't need it. At that point, you can wake up in the morning, not having eaten for 10 or 12 hours, and still see a high blood sugar reading. People think, how is that possible? I didn't eat. But your liver can behave like a sugar factory, especially when it becomes insulin resistant, and early morning hormones can nudge it too. That's why morning highs happen, and that's why you don't want to interpret every single number as a moral failure. It's physiology. Now let's get practical, because this is where most people go wrong. The first mistake is not washing your hands. If you touched fruit, cut a banana, handled something sticky, or even just had residue on your fingertips, you can get a falsely high reading because that sugar mixes with the blood drop. Wash with soap and water, rinse, dry completely, then test. Second mistake, using an alcohol wipe in testing while the alcohol is still wet. If you do use alcohol, let it fully dry before you test. Don't rush it. Third mistake, using expired strips or strips that were stored badly. Strips are chemistry. Heat, humidity, and time degrade accuracy, so don't gamble with old or poorly stored strips. Fourth mistake, testing right after extreme heat or cold exposure like a sauna or cold plunge. Temperature and circulation changes can distort readings, and heat and humidity can affect strips and devices too, so return to normal conditions before you trust the number. Fifth mistake, taking certain supplements or meds right before testing, especially when you're trying to measure fasting glucose. Some devices can be affected by certain substances, and even if your device isn't, the bigger issue is consistency. If you want clean data, test first, then take coffee, vitamins, or anything else. Sixth mistake, squeezing or milking your finger. When you squeeze hard, you can mix tissue fluid into the blood sample and dilute or distort the reading. You want a gentle drop, warm hands, light pressure, not a wrestling match. Seventh mistake, expecting perfectly consistent readings when your routine is inconsistent. If you test at random times, in different conditions, in different moods, after different sleep, you'll get noisy results. Standardize your process so your numbers actually mean something. Eighth mistake, switching fingers and sites randomly. Blood flow and callus thickness vary, so pick a couple of consistent fingers, often middle and ring, and rotate gently within that small set. Ninth mistake, comparing continuous glucose monitors to finger sticks like they're the same thing. CGMs measure glucose in interstitial fluid and can lag behind blood, especially after meals or during rapid changes. So if you're using a CGM, understand timing. If you're tracking post-meal glucose, pick a consistent window, like 1 to 2 hours after your first bite, and compare apples to apples. 10th mistake, compression lows on a CGM. If you sleep on the sensor and put pressure on it, you can get weird low readings that don't reflect reality. If a reading looks suspicious, especially overnight, confirm it if needed and consider sensor placement and sleep position. 11th mistake, high altitude. Some meters can become less accurate at high elevations, so be cautious interpreting numbers at altitude and follow the manufacturer's guidance. 12th mistake, coffee and stress before testing. Caffeine can increase adrenaline and cortisol in some people, and stress can do the same. Both can nudge the liver to release more glucose. If you want a true fasting baseline, test before coffee and before the day's stress hits full volume. 13th mistake: misreading a high fasting morning sugar as a dead end. Morning highs are often a sign of insulin resistance, especially in the liver, and they improve with the same big levers that fix the overall system: better sleep, lower refined carbs, more movement, and consistency over time. Now let's talk about A1C, because people treat it like the final boss. A 1C estimates average glucose exposure over roughly the past 2 to 3 months based on how much glucose has attached to hemoglobin in red blood cells. It's useful, but it's not perfect. Anemia and differences in red blood cell turnover can affect it, and some populations can show slightly different A1C patterns at similar glucose levels. So A1C is a powerful tool, but it's not a complete story by itself, and it's not a moral judgment. It's a clue. So what do you do if you're heading toward type 2 diabetes or you already have it? Here's the cleanest mental model. Type 2 diabetes is often driven by insulin resistance and excess energy load, with the liver playing a huge role in releasing glucose when it shouldn't. The good news is that the liver responds quickly when you reduce the glucose load and reduce insulin demand. That's why lifestyle changes can be so powerful. For many people, bringing carbs down, focusing on minimally processed foods, and reducing the frequency of eating can dramatically improve blood sugar and insulin sensitivity. Add consistent movement, especially walks after meals, and strength training to build muscle, and you improve your body's ability to store glucose where it belongs. Protect sleep and reduce chronic stress, because hormones are not just emotions, they are part of glucose regulation. Stay hydrated and mind electrolytes, because dehydration can distort readings and make the whole system feel worse. If you want a simple experiment that teaches you fast, try this. On a morning when your glucose is high, test, then take a 15 to 30-minute walk, then test again. Not as punishment, just as feedback. Your body is a lab, your meter is a compass. The goal is not to obsess over every number. The goal is to calm the system, lower average glucose exposure, lower insulin demand, improve sensitivity, reduce the liver's unnecessary sugar output, and build routines that make your body stable instead of reactive. When you do that, the numbers stop feeling random and your meter stops being a source of fear. It becomes what it was always meant to be, a tool that helps you steer,